Restricting advertising, particularly in its impact on young people, is a significant step.
The government is proposing a ban on vape ads anywhere kids can see them. It's a step social media giants and most provinces are taking on their own, but Quebec has already done it. And doctors say it didn't work.
The regulations that have been proposed have already been in place in Quebec, for instance, for some time, and they've experienced the same rapid increase in vaping amongst young people as is being experienced all across Canada.
Health Canada released new figures today detailing that rapid increase. The number of Canadian teens who say they'd been vaping in the previous month has nearly doubled, going from 15% in the 2016-17 school year up to 29% last year. Researchers say those numbers are still rising. Experts don't understand what kind of evidence the Prime Minister is waiting for.
We've already got evidence that the number of kids that are vaping are at record highs. There's no sign that we've plateaued. And we have evidence from 100 years of trying to regulate nicotine in conventional cigarettes that job number one is to reduce uptake among kids.
Health Canada is also proposing health warning labels on nicotine vaping products, requiring companies to tell Canadians vaping has health risks and the products are addictive. But there's no mention of limiting flavors or the amount of nicotine in these pods, which is similar to a pack of cigarettes.
I think it's important that we recognize that these are products that need to be addressed in exactly the same way that we've addressed tobacco products in the past. There are lots of lessons to be learned from our experience in that regard, and unfortunately Health Canada has not yet seen fit to apply the lessons that we've learned.
This is definitely a first step, and that's certainly what the Health Minister talked about. There's a lot more information to gather.
Until that information's gathered, expect to see more and more of this. Christine Birak, CBC News, Toronto.